Good afternoon, everyone. I am Aisha Ahmed. I will be your master of ceremony for this debate. So we will just wait for 2 minutes because we want everyone to settle down, and then we will start. Is that fine? Yeah. Thank you. Can everyone please settle down in the back so we can start? Can you tell them to start this mic? This is not working. Okay, so we're just waiting for everyone to settle down. So, can you hear me? You hear me? Okay. Fatima, whenever you're ready. Yeah. So as you can see in the front, Fatima Nazar is basically briefing the judges about the debate. So when she's done, which she is, we're going to start now. All right. So welcome everyone to the 2023 Interprofessional Debate Challenge. It is my pleasure. My name is Aisha Ahmed. I'm a fourth-year pharmacy student at Qatar University. So I hope that this debate will be a beneficial and enjoyable experience for you. Now, first of all, you can see the motion on the slide. I want to introduce you to Fatima Nazar and Sausan. First of all, Sausan Al-Muqdad serves as Interprofessional Education Clinical Specialist at Center of University, Qatar University. Now, beyond her academic achievements, Sausan presided over the IPE Student Association for 3 consecutive years, where she orchestrated impactful student-led research events, annual forums, and debates. So that's Sausan here on my left. Now, I will introduce you to Fatima Nazar. Fatima Nazar is a PharmD student and one of the leads for this debate. She is the former president and current senior mentor for Qatar University English Debate Club. She has represented Qatar University in many national and international debates. She is also the representative of the College of Pharmacy in IPE Student Association. She will be introducing the debate format and share more details with you right after I'm done. So first of all, what is the IPE Debate Challenge? Well, the interprofessional debate is an informative, challenging, and exhilarating competition for the participants of the A2B Edge conference. This competition gives students a chance to perform and on a platform that enhances their skills for research, critical thinking, argumentation, and communication. Furthermore, it also gives the participants a chance to nurture their research skills as they look for compelling and sound evidence to support their arguments. In general, this endeavor serves as an excellent means to foster the professional development of the participating members while instilling a sense of collaboration. Now, without any further ado, I want to introduce Fatima Nazar, who will share more details about the debate format with you. Fatima, the stage is yours.
Dear esteemed guests, debaters, judges, and attendees, welcome to the ATBH Student Debate Challenge. It is great honor to be the lead for this debate challenge along with Dr. Sausan. I'm grateful to the ATBH Organizing Committee for allowing me to execute this challenge, as I'm a firm believer that debate and dialogue are integral components of well-informed decision that we have to make throughout our days as healthcare providers, as students, as educators, and even as we're going on with our daily life, we have to make decisions, and we go on with the debate. Furthermore, the integration of research and evidence into arguments solidifies our stance and helps us nurture our critical thinking skills, which is essential for interprofessional collaboration and practice. I'm very proud of the teams in this debate as they are interprofessional and intercultural in nature. I'll introduce to you the participants. Each participant is representing their institution and their profession. I would also like to extend my heartfelt gratitude to our esteemed judges for reserving their time for this event and for providing us with their valuable feedback. As you see on the slides, on the affirmative team, we have 3 students. Aisha Ahmad, who is a pharmacy student from De Montfort University, UK. Jocelyn, a medical student from University of Global Health Equity. Khadija Muhammad, who is a dental medicine student from Qatar University College of Dental Medicine. Please give a round of applause for the affirmative team. On the negative team, we have Alia Muzaffar representing the University of Calgary as a nursing student. We have Jean Bertrand, who's also a nursing student from University of Calgary, Qatar. And I'm sorry, but there's an error in the slides. It's the medical student, and he's from the University of Global Health Equity. We have Saim Rahman, who's a pharmacy student from De Montfort University in UK. Please give them a round of applause. Now, let me introduce you to our judges for this debate. First, we have Dr. Jim Campbell, who's the Director, Health Workforce of World Health Organization, Switzerland. Then we have Professor Jill, who's an adjunct professor, Faculty of Health, University of Technology, Sydney. Then we have Professor Egan Toft, who's the head of research in Aalborg University Hospital, Denmark. Then we have Dr. Medhad, who's the Associate Vice President for Clinical Affairs of Qatar University and head of the Clinical Immunology Division of the Department of Laboratory Medicine and Pathology at Hamad Medical Corporation, Qatar. And finally, we have Professor Mahmoud Adil, who's the National Healthcare Advisor, Ministry of Public Health, Qatar. Please give them a round of applause. I once again thank the esteemed judges for providing us with their valuable feedback and time. Let's move on to finally explaining what the debate will look like. I would urge you all to please pay special attention as this debate is the academic debate format, and it is a bit tricky to follow, but it's very easy if you pay attention. There are 3 students in each team, as you can see. For the sake of understanding, we have divided the debate into 3 parts. The first part starts with the first affirmative constructive speech. This is the first speech which is given by the affirmative team, and it's given by the first student. Then you have a break. In this break, the audience, I urge you all to remain calm as the teams will decide and strategize because they will be asked questions on the basis of their speech. So, the student who will be giving the first affirmative constructive speech will stay here at the podium, whereas the negative team will prepare their questions. And they will ask their questions after the caucus while they're standing here. And the student will answer from the podium. Only the student who has given the speech can actually answer the question and cannot take the help of his or her teammates. Moving forward to the first constructive from the negative side, and this is the first speech from the negative side. It is also delivered by the first student from the negative side. And then again, similarly, the same fashion, you're going to have a break, after which you'll have a cross-examination in the same pattern as the first constructive for the affirmative side. This concludes the first half of the debate. Moving forward, you will then have the second constructive speech. There are two constructive speeches in this debate. The second constructive speech will be delivered by the third student of the affirmative speech. And then again, the negative team will question them on their speech. Similarly, the second negative constructive speech will deliver the speaker will deliver their speech, and then they will be cross-examined by the affirmative team on the basis of that speech. This concludes our second half of the debate. And now finally, the adrenaline rush part, your rebuttals and refutations. You'll have a brief caucus break before the first constructive speech. The first negative rebuttal will be given by the second negative speaker. They'll have about 5 minutes to make this rebuttal. Rebuttals are really important to reaffirm your points and stance. Similarly, there's no break. Immediately you'll have the first affirmative rebuttal from the affirmative side. Please take note that the rebuttal starts from the negative side and concludes at the affirmative side. There are two rebuttals in this debate. The first one from the first negative, then the first affirmative, and the second one as well from the second negative and then the second affirmative. And finally, in the end, we'll have the chance for the judges to ask questions to the debaters. But these questions will not be marked. They will not be a part of the grading, but rather questioning them about their idea as well as the knowledge for the debate that they've had so far. This is the debate format that we have. Without further ado, this House believes that interprofessional practice and education should be incorporated into licensing, pre-licensing, pre-registration, and certification requirements for healthcare and social care professionals. I introduce to you the debate motion for today that you will be seeing here. I wish all the teams all the best, and all the judges, once again, thank you for your time.
Thank you so much, Fatima, for the details for the debate. Now we're going to move on to the debate itself. As you can see on my right-hand side, we have the affirmative team, and on my left-hand side, we have the negative team. So I want to call upon the first speaker from the affirmative team to give the constructive speech, which will be for 5 minutes. And at the 4th minute, you will hear a bell, so the speaker knows that she only has 1 minute to wrap up her speech. At the 5th minute, there will be 2 bells, and the speaker will not be allowed to speak any further. Now, without further ado, we're going to start the timer, and we will have our first constructive speech from the affirmative team.
Good afternoon, ladies and gentlemen. The increasing prevalence of chronic diseases and rapidly aging population have created a real need for a healthcare delivery system that is well integrated and coordinated using a multidisciplinary approach. Now, the first step in fulfilling this need is incorporating interprofessional education into licensing, pre-licensing, pre-registration, and certification requirements for all health and social care professionals. In a study that looked at the longitudinal impact of pre-registrational interprofessional education and how this affected the attitudes and skills of healthcare professionals in their first 3 years of practice, it was found that graduates who attended the IPE program perceived that the program had a meaningful influence on their readiness to work in teams and the way in which they performed their healthcare roles over the course of a few years. This study establishes a clear, undeniable link. This link is between interprofessional education and the long-term successful collaboration of healthcare teams. In a separate study, it was found that in a batch of 500 students, those that completed IPE pre-registration were not only able to maintain the interprofessional skills that they gained, but actually improve them once they became healthcare professionals. This is a stark comparison to their counterparts who graduated without IPE and acknowledged the need for it only when they entered practice. So what does this highlight for us today? This highlights one crucial point. Interprofessional education is a definite prerequisite to successful collaborative practice. The undergraduate student will then understand their own professional role while simultaneously appreciating the role of other healthcare professionals and understand the system that they will be working in. Until and unless IPE is made mandatory for certification, no alternative framework can integrate value and skill-based learning with profession-specific knowledge. Without the integration of value and skill-based learning with profession-specific knowledge, our healthcare teams of the future cannot be equipped to provide efficient and coordinated patient-centered care. In a study that looked at the longitudinal impact of pre-reg interprofessional education and how this affected the attitudes and skills of healthcare professionals in the first 3 years of practice, we found that IPE was important and sustainable all through those years. So how do you provide IPE in a way that is sustainable for all education providers? The American Association College of Pharmacy have suggested that with IPE framework, we must start small and go slow. This means that regardless of institutional or national resources, a gradual implementation of IPE into the curriculum can be facilitated. This model has worked well for countries like the UK, where every academic year, 1 day is designated to IPE. Not only is this sustainable in the long run, but it is a necessary step in designing the healthcare teams of the future. Elective or voluntary IPE can give the message that this type of learning occupies a low status in relation to other forms of profession-specific learning, which then may in turn reduce the learner's commitment to IPE. However, if we standardize IPE, make it a mandatory requirement, and give this value-based learning the importance it deserves, whilst also maintaining a standard of patient-centered healthcare across the professions, this is a goal that we can attain and we can achieve better health outcomes across the world. To summarize, the affirmative team argues that IPE cannot be made optional. Instead, IPE must be a mandatory component of all certification requirements for health and social care professionals, only because of the value it provides in the long term to healthcare professionals. IPE prepares a pre-registration student for the world of healthcare. It prepares the student for collaboration, commitment, teamwork, communication, and interprofessional learning. By making IPE compulsory, we maintain a standard across all medical professions when it comes to skills such as teamwork and communication, but simultaneously, we are also investing in the healthcare teams of the future. Thank you very much.
Thank you, speaker, for your amazing speech. Now we're going to have 1 minute caucus where the negative team is going to discuss and come up with a few questions based on the first speaker's speech. I would like to request the speaker to stay at the podium, and when we start the cross-examination, she's going to answer from the podium, and we're going to have one representative from this team asking the questions. So just 1 minute for their discussion, and then we will start the cross-examination. All right, time's up. So we have a designated speaker from this team. Yeah. And just so you know, before we start, the speaker is only allowed to answer with yes or no. She's not allowed to elaborate. Yes, can we have the designated speaker with the mic, please? Thank you. Okay, you have 3 minutes to do your cross-examination.
Okay, so here we have a few questions. So first, will the people who will develop the licensing requirements be from all the healthcare and social care professions, or it will be just from some particular professions? So,
Could you repeat the question, please?
will the people who will develop the licensing requirements be from all healthcare and social care professions?
So will the people who need the requirements be all health and social care professionals?
Or a specific profession? So will it be from all social and healthcare professions?
No.
Okay. And then will the period of the required interprofessional education and practice be standardized, or professionals to be for professionals to be licensed or certified? So will the period that is required for that education that you're advocating for or practice be a standardized period, or that has to be licensed or as to why licensing, or it shouldn't be so?
No.
And then are the lessons that are going to be provided be contextualized based on the setting of the healthcare profession or the area where people are working from or studying from?
I'm sorry, I didn't understand the question.
I'm asking if the lessons that will be provided during education, or what will be based on during the practice, will it be contextualized based on the setting of people that the professionals will be working from?
I still can't understand the question. I
You want
apologize.
paraphrasing? Can you please paraphrase the question?
Okay, we can ask another question. So you said about the chronic diseases being reduced by IPE.
All right, thank you. We don't have time. Thank you so much. I'm sorry to cut you off, but we are done with the cross-examination. Thank you for your answers for the first speaker. You can take your seat. Thank you. All right. Now we're going to have the first speech from the negative team. It's the same as the first speech from the positive team. It's going to be for 5 minutes. We will hear a bell at the 4th minute and 2 bells at the 5th minute. This is our first negative constructive speech for 5 minutes.
Hello, everyone. For today's debate, we stand firmly against the motion. This House believes that interprofessional practice and education should be incorporated into pre-licensing and prerequisite. Let's just clarify the motion first. It discusses the terms both educational and professional practice, which means the undergraduates and the healthcare profession. While we acknowledge the importance of collaboration and communication within the healthcare and social care workers, we believe that an exclusive focus on individual profession and education specialized should be maintained for several arguments that I have. My first argument states that implementing